Magandang tanghali po sa inyong lahat. I am Dr. Rosellee Cainto-Bayona, an internist and a wellness practitioner at the Wellness and Aesthetic Institute of the Medical City. I am very honored to be with you today together with my co-presenter, Dr. Rhodora Ramos-Jayson. We will be presenting to you about stress during pandemic. Okay, so during our presentation, kindly put your microphone to mute so that we can focus on the topic. You can type in the chat box any questions about the topic and we will answer them after the presentation. So what are our objectives in this presentation? We need to define first what is health in general, mental health, and stress. We will be discussing the causes of stress during pandemic and also about the symptoms of stress. And our last objective, which will be presented by Dr. Jayson, is the adaptive and maladaptive coping strategies. So what is health? According to the WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But according to Merriam-Webster, it is the condition of being sound in mind, body, or spirit, especially freedom from physical or disease or pain. Okay? It is merely the general condition of the body. It may be in good health or in bad health. So what is mental health? According to the WHO, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and can able to make a distinct contribution to his or her community. So we have to define what is stress. Okay? So stress is defined as the pressure of life and how one perceives, believes, reacts, and copes with stress. Okay? Stress is experienced when emotional or physical or environmental demands exceed a person's resources and ability to cope. So for prolonged unmanaged stress, stress can lead to anxiety and depression. So are you stressed over COVID-19? Kamusta po kayo noong nag-start ang lockdown? How do you feel sa mga balita over the TV or social media? No? Yung nakulong tayo na ilang buwan sa bahay, na hindi tayo makalabas, no? Hindi natin alam kung ano ang ating mga gagawin, hindi tayo makapagtrabaho, walang kita, at marami pang iba na kanya-kanyang dahilan. No? Maraming pwedeng pagmulan ng stress. Okay? So stress can be the feeling of uncertainty. Kasi nga, walang kasiguraduhan kung kailan matatapos ang pandemya. Hanggang ngayon, wala pang bakuna, wala pang definite treatment laban sa sakit, paano na ang trabaho o hanap buhay ng mga pag-aaral ng mga bata at marami pang iba. It is also fear and worry about own health and health of loved ones. Since we know that it is a deadly disease and wala pang cure bukod sa presyo ng hospitalization, no? Kung magkasakit tayo, what if, no? So ang dami nating worries about this pandemic, no? Stress from the experience of monitoring yourself or being monitored by others for signs and symptoms of COVID-19. Okay? Every now and then, we check ourselves, no? We check our temperature, tinitingnan natin kung may simpleng sore throat ba tayo, ubo, sipon, no? Yan. Kahit saan tayo pumunta, chine-check ang ating temperature, no? Minsan nga nangyari sa akin, no, hindi ako pinapasok sa Home Depot kasi yung body temperature ko reached at 38.4, no? So kasi syempre naglakad ako sa initan ng araw. So naghintay ako hanggang bumaba yung temperature ko pero bumaba lang siya until 37.9. So sa kakahintay ko, nainip na ako, umuwi na lang ako. So nainis pa nga ako kasi hindi ko nabili yung gusto kong bilhin. Okay? So pagdating ko sa bahay, naligo agad ako, no? Tapos so, nag-check ako ng body temperature ko, then yun, pag-check ko, 36.7, o di ba? Nakakapraning, no? So, and also yung guilt about not being able to perform normal work or parenting duties during quarantine. Okay? So, actually, I can relate to this. No? During the start of lockdown, we were asked no, kung sino pwede mag-duty sa amin sa hospital since some of our residents were put into quarantine kasi yun nga, mayroong mga na-positive. No? So, I felt guilty kasi hindi ako makapag-volunteer no? Since I live with my mom, who's a senior citizen, marami siyang mga medical condition, and yung feeling na hindi ko makakasama yung mga anak ko no, sa bahay, no, medyo hindi ko yun kinaya, kaya yun, hindi ako nag-volunteer. So I feel guilty of not being of help. Okay? So stress can also be the feeling of socially isolated. Okay? So marami sa atin na nag-lockdown, no, inabot na sila sa kusang lugar na nag-iisa sila no, sa kanilang bahay, no? So at saka yung mga ibang pasyente na nag-positive sa sakit, no, they have to be quarantined or admitted in the hospital na walang kasamang kapamilya, no? So yung feeling ng isolation, no? So sobrang nakakadagdag talaga yun ng stress, no? And of course, no, yung worsening of chronic health conditions and of course, worsening of mental health conditions. No? Dahil nga bawal lumabas, no? Takot magpatingin sa ospital at hindi lang yun, no? Maraming doctors din na hindi rin nakakapag-clinic, no? So hindi nila alam kung saan sila pupunta. At bukod doon, no, walang transportation. No? So ang hirap talaga, ang hirap magpunta sa kung saan na nila gusto magpunta na magpatingin. No? So lalo na yung may mga medical conditions like yung nagda-dialysis, no, nagki-chemo, no, yung may mga sakit sa puso, no. So lahat yun halos medyo napabayaan, no. Masyado tayo nakapag-focus sa COVID-19. Okay? So kaya yan, isa rin yung pinanggalingan ng stress. Okay? So stress can be changes in sleep or eating patterns. Lalo na 'di ba nung umpisa, hindi pa tayo medyo nasa-stress no. So feeling vacation mode tayo. No? So, nagpupuyat, nanonood ng Netflix, no? Tapos noon, kain ng kain, no? Parang bakasyon nga, no? Dahil ang daming nag-hoarding ng pagkain, no? So medyo napasarap ang kain. But eventually, no, habang tumatagal, no, dahil nawala yung routine na usual na ginagawa natin before the lockdown, naging medyo bored na yung mga tao, no? Nagiging uneasy na sila. No? So, yun, apektuhan na kanila ang pagtulog at yung ganang kumain. No? So, some patients will have difficulty of sleeping and concentrating kasi nga, they're so anxious na no? Worried na sila sa mga nangyayari sa paligid no? At sa sarili nila. Okay? And because of this, some will result to alcohol, no? Increased use of tobacco, or yung iba pa nga, the drugs. Okay? So, what are the symptoms of stress and anxiety? Okay, so others can feel confused. No? They have the sense of helplessness. Okay, yung iba will have repeated negative thoughts. No, example, yung mga paulit-ulit nila na iniisip nila na may sakit sila or magkakasakit sila, na may COVID sila, no? Simpleng sakit o sipon, no? Iniisip nila COVID agad. Okay? So yung iba naman will feel easily agitated, no? Meaning madaling uminit ang kanilang ulo, no? Halos lahat ng mga kasama sa bahay medyo inaaway, no? So marami nang ganyan ngayon, okay? So of course, yung nga sabi ko nga kanina, yung iba will have difficulty of sleeping, okay? Others will have chest discomfort, difficulty of breathing. Yan, ang daming ganito actually, no? During my online consultations, ang dami kong pasyente, very young age, wala namang ibang sakit, no? And yet, ina-associate nila, no, yung difficulty of breathing, yung iniisip nila na may sakit na agad sila sa puso, no? Na ina-associate na nila agad na COVID yun, no? Kasi since marami nga silang nababasa sa social media about sa iba't ibang symptoms ng COVID, no? Ina-associate nila agad yun sa sarili nila. No? Others can have muscle pains or tension, no? Yung sakit sa batok, sa likod, yan. Maraming nakakaramdam yan. And change of appetite. No? It's either extreme yan. It's either people can experience walang ganang kumain, or iba naman, kain ng kain. No? Yun yung isang ano nila kung mag-cope ng stress. Okay? So, ano naman yung long-term effect? No? ng, ng stress. Okay? So, of course, we know ang long-term effect nito patient can be anxious and can lead to depression. Okay? Others will have heart attack or heart disease, no? Especially yung may mga medical conditions na talaga. Okay? Hypertension. Others can have a stroke. Okay? Weight problem. So I said extremes yan. It's either mag-lose sila ng weight, no? Or sobrang namang laki ng increase ng weight nila. Others can have gastritis or any gastric problem, no? Yung parang laging sinisikmura, no? Parang umaakit pa nga, may heartburn sila, no? So marami silang pwedeng maramdaman niya sa tiyan, no? Na yung iba nagkakaroon ng bowel movement changes na parang nag-LBM sila, yung iba nagkakaroon ng constipation. Okay? Other long-term effect, others can have mga skin conditions, no? Yung mga acne, mga pimples, no? At hindi lang pimples, mga dermatitis, yan. Or others can have hair loss, no? Not the usual hair loss na mga nangyayari sa mga lalaki, no? But yung abnormal na hair loss na patsi-patsi, no? Patsi portion lang ng kanilang buhok ang nawawala. And of course, yung iba nagkakaroon ng sexual dysfunction, no? So sa lalaki will have erectile dysfunction, no, or pre-ejaculation. Sa mga babae naman, mababa ang kanilang libido or walang gana. Okay? So, but always remember that everyone is different. No? So we have to accept na stress is there. No? So some people thrive under pressure, others succumb to it. No? But it doesn't mean showing signs of stress na we are weak. No? So we only means na we are just human. Okay? So there. So maraming mga paraan kung paano natin makukup ang stress, and that I will give you to our next speaker, no, who will lecture on the next part of our webinar today. Please welcome Dr. Rhodora Ramos-Jayson, who is also an internist and a wellness practitioner here at the Medical City. Okay, so please welcome Dr. Jayson.
Hello, good afternoon, everybody. Again, I am Dr. Rhodora Ramos-Jayson. Thank you for that kind introduction, Dr. Sel. Okay, so now that we have discussed the causes of our stress during this pandemic, let us tackle ways on how to deal with them. Here are some adaptive coping strategies to be able to take care of our physical and mental health during this time. These are the following. So, staying connected, maintaining a healthy lifestyle, staying positive and informed, and seeking support when needed. Let's go through them one by one. One very important strategy that will help us cope is to stay connected. Having an open communication with those people who we trust, be it a friend, a family member, or a loved one, provides social support to help us deal with the anxiety of this pandemic. We can use of different platforms like text messaging, phone calls, Messenger, Viber, or any technology that you can have access of. With this, you will realize that it is normal to feel sad, stressed, confused, scared, or even angry during this time. But what's important is how you can positively adjust to the new normal. Okay, so self-care by maintaining a healthy lifestyle is also a fundamental coping strategy. This can be summarized into eating healthy, doing exercises, and sleeping well. Nutrition during pandemic was discussed thoroughly in the webinar yesterday. I hope you were able to attend. The choice of food is crucial to be physically healthy. It should be balanced, composed ideally of whole food, not the processed ones, and with generous servings of your fruits and vegetables. To add, aside from food, we should also be properly hydrated, with water ideally. As much as possible, avoid too much intake of sugar or salt. Okay, so now that we are in our GCQ or General Community Quarantine, many of us are already allowed to go out to have some activities like jogging or brisk walking. But we have to remember that there are exercises that can also be done in the comfort of our homes. It can be as simple as stretching or as vigorous as a short, high-intensity workout. The thing is, you just have to make time. Lastly, sleep. Okay, sleep is our body's way to rest and regain energy. This is like a reset button at the end of a long and stressful day. The importance of sleep and exercise will both be talked about thoroughly in the coming days. For adults, sleeping for about 7 to 9 hours a day should be enough, because if you sleep for too long or too short, it can also have negative impact on your health and disposition. Next is staying positive. Amidst the pandemic, we always have to remember that what we are going through, the quarantine, the furlough, the separation from our loved ones, the daily challenges that we are all facing are all temporary. It will also help us if we hold on to our faith in our families. Let us set our minds that these will all pass and that better days are coming ahead. From time to time, it is advisable to have a break from social media, simply because it adds up to our anxiety. But since we want to be aware of what has been happening, we have to be responsible in finding credible sources that are trustworthy, like the World Health Organization and the Department of Health. Remember that not everything that is available online is true. Napakadami pong fake news. We have to carefully discern a fact from a myth. We don't want to be causing unnecessary panic to other people by sharing unverified information. Okay, so even if despite all the coping strategies that we discussed, there will still come a time when the stress and anxiety are just too much to bear. If you feel that you can't hold it any longer, always remember that you are not alone. It is more than okay to seek professional help if everything seems to be overwhelming. You can talk to us, your wellness doctors, or other specialists for support. Okay, so stress, as mentioned by Dr. Rosellee, can undoubtedly cause tension to our bodies on top of the anxiety that it brings about. In addition to the mentioned coping strategies, here are some ways to relax our minds and our bodies. Okay, first, you can close your eyes, take slow deep breath, inhale through your nose, and then hold it for a few seconds, and then exhale through your mouth slowly. You can do it for a few cycles, and then eventually you will feel more relaxed. Next is soaking in warm bath or having a warm shower. Listening to soothing music is also one, and practicing mindful meditation. The goal of the mindful meditation is to focus your attention on things that are happening right now in the present moment. So for example, listen to your body. Is your breathing fast, slow, deep, or shallow? Do you hear noises such as traffic, or do you hear only silence? The idea is just to note what is happening without trying to change it. So this mindful meditation is best done with your eyes closed, of course. Okay, next is relaxing the body. Yoga, we are all familiar with that one, is popularly known as a form of exercise. But it is actually a combination of physical and mental practices that can help improve one's flexibility and strength. Progressive muscle relaxation is a deep relaxation technique wherein you tense one muscle group, hold it for about 10 seconds, and then release. You can actually simultaneously do this with deep breathing exercises as you go from one muscle group to another. However, this is not advisable to those who feel pain in their bodies. Okay, so for example, you can make a fist with both of your hands and then close your eyes, hold it for about 10 seconds, and then gently release. By doing this, you can differentiate a tense muscle from a relaxed muscle, which will eventually result to a more relaxed body. Or you can just get a massage, a warm drink, a non-alcoholic warm drink, or any other physical activity. These mentioned relaxation techniques are simple and effective without the need to go out or spend. There are also some tutorials online that you can follow. Okay, so here are more coping strategies that you can do. For example, focus on practical activities that you can do for now. At home, for example, you can venture into cooking and maintaining a normal schedule, keeping a journal, and of course, the use of humor. All of these are just recommendations, okay? Remember, please, you can always make use of your own approach in dealing with stress without compromising your health. So we already discussed the adaptive coping strategies. Let's go through the maladaptive coping strategies. These ones we do not advise. The aim of discussing both the positive and the negative forms of coping are to help people consider the different coping options, identify and acknowledge their personal coping strengths, think through the negative consequences of the maladaptive coping actions, encourage everyone to make conscious goal-oriented choices about how to cope, enhance a sense of personal control over coping and adjustment. So let's go through them. I think it was mentioned earlier that some people cope by using alcohol or drugs. withdrawing from activities or from family or friends. We mentioned that we need all the social support that we can get. So this one, we should not do. Working for too many hours. A lot of us are doing work from home and hindi na ma-differentiate which one's for work and which one's for family time. And okay, we mentioned kanina also that it's okay to be angry, but it's not okay to be violently angry. Excessive blaming of self or others. Overeating and undereating is not it's not self-care. Watching too much TV or playing too many computer games. Doing risky or dangerous things and not taking care of yourself. Okay, you notice that these are the opposite of what we discussed earlier, and they are not recommended simply because they're ineffective in addressing the problems, and they can even cause more harm to a person's health. We all know that everything that we're going through right now is temporary. The goal of our discussion of the adaptive coping strategies is to make us all resilient to the current situation. Resilience is defined as the ability to become strong, healthy, and successful again after something bad happens, like this pandemic. Ultimately, these will all pass and we shall come out as strong and as resilient as ever. Here are some practices that are repeatedly being reminded to us to avoid infection or spreading the virus. So you have to wash your hands regularly with soap and water, avoid touching your faces, practice the proper cough etiquette. You may or you may not use disposable tissues. Practice physical distancing, cleaning and disinfecting frequently, especially the high touch points, and staying at home unless absolutely necessary. Remember that you cannot always control what goes on the outside, but you can always control what goes on the inside. So it's your inner self. And the same, boiling water that softens the potato hardens the egg. It's not about the circumstances, but rather what you are made of. For questions regarding the topic and inquiries about our services, please contact us via the following details. You may take a screenshot for your reference. This concludes our report. We will now be entertaining questions. Thank you all for your time. Good afternoon. Hi everyone. So we are back. Let's go through the questions. One of you asked this. Okay, Miss Helen. Miss Helen asked for the potato and the egg. Okay, here it is, ma'am. And okay, many are asking about sleep. For that one, we will be having another webinar like this on the 29th. That will be by Dr. Katrina Bundalian on Monday. So please attend that one also because she will be thoroughly discussing about sleep. Okay. Any tips on how to improve the quality of sleep? Okay, for that one, I think this will also be addressed by Dr. Kat Bundalian. But for now, what you can possibly do is at bedtime, avoid drinking caffeinated drinks because it wakes you up. It's an upper. And you can have a warm shower, a warm bath. You can listen to soothing music, have the lights off for the melatonin to be secreted in your body and induce more sleep, better sleep. And you can also drink milk. Milk can also induce the production of melatonin, the sleep hormone. If patients are from Mr. Bien, if patients are afraid to go to hospital or clinics due to COVID, it contributes to anxiety. So how can they resolve this? Okay. Particularly for the medical city, we have this the safety protocol wherein in one complex you have two hospitals. We have a screening area in the foyer, and then our trained nurses will be the one to tell the patients where to go. There's a green lane, there's a yellow lane. And with that, the green lane, of course, will be the safer ones. Those who don't have the symptoms of COVID will be directed to that. And those who have suspicious findings will be guided through the yellow lane. So I think not only the medical city, maybe other hospitals also have their own safety protocols also to follow. And please remember to wear your masks when you go to the hospital or any other places, and observe proper hygiene also.
To add to that, so for the patients who are really afraid to go to the hospital or to the clinic, they can opt teleconsult, so they can call their doctors, siguro if they have contact numbers ng doctors nila, ng attending doctors nila, they can ask their doctors if they're amenable to a teleconsult instead. So since yun ngayon ang mode of ano namin, no? Para mag-entertain ng mga patients since marami natin na afraid to go out of their houses. No? So try yung teleconsult is another option po.
Okay, so how can you improve your sleep if you have sleep apnea? Aside from CPAP, are there any other methods? Okay, for sleep apnea, I think this one is, it has an underlying cause. So for it to be resolved, we have to treat the underlying cause. And one of the treatable, modifiable factor that we can do is, of course, the weight loss. Because obesity is a risk factor to develop your sleep apnea. So if we can focus on the weight loss, then your sleep apnea will also get better. Okay, but for now, the machine, the CPAP machine will be a lot of help. So with that, we will end our report. Thank you all for attending. This is Dr. Rhodora Ramos-Jayson, and this is Dr. Maria Rosellee Cainto-Bayona. Thank you all for your time.
Thank you.
Bye.
Have a nice day.